From Arkansas's breaking news leader, Fox 16 News at 9 starts now.
During the month of March, doctors and healthcare providers are bringing awareness to colon cancer, reminding people of the importance of getting your screenings and exams. In tonight's Living Well report, Claire Kreitz shows us how one Baptist health doctor found himself the patient, learning just how critical that advice can be.
This really was a time of practice what you preach.
As an MD at Baptist Health, K. Morgan Sauer is consistently reminding his patients to get their checkups, scans, and screenings, especially when it comes to colonoscopies.
Colon cancer has really started to become far and far more prevalent in our society, especially in younger and younger people.
Dr. Sauer says that's why the U.S. Preventative Services Task Force lowered recommendations for colonoscopies from 50 years old to 45 years old. Unless there's a family history or other factors that increase your risk, then it's even lower.
We could actually reduce colon cancer deaths by 2/3 in this country if people would actually go get their screening colonoscopies like we're told to do.
But when it came to his own health,
I was not the best patient. Doctors usually aren't, and I waited till 47.
He went into his screening with no signs that anything was wrong, but when he woke up,
it turns out I had tubular adenoma, which is a very close precursor to actually having colon cancer.
Luckily, doctors were able to take care of that during his colonoscopy, but if he had waited much longer,
we weren't going to be dealing with something that was handled right when I was in the middle of my colonoscopy, soundly asleep, but instead I would have actually been having surgery and probably chemo for colon cancer.
Learning a lesson and following your own advice.
That was a big wake-up call.
Dr. Sauer says he can now tell patients from his own experience just how vital it is to follow doctor's orders.
I had absolutely no symptoms with mine, and I was just a couple steps away from colon cancer. So to people who say, I just don't want to go do this, it's time to do this.
I couldn't agree with you more. Dr. Sauer says it's important to talk to your primary doctor about when you should get your colonoscopy. And again, the recommended age is 45, but sooner if you're having symptoms.